We are. Excellent. All right. Good morning.
Good morning.
We are here with Christina Kupper, and she has Equine Kneads. And I met Christina years ago, and her brilliance really kept in my mind. And if I think of any person who should educate us on PEMF, it is Christina. She has many things that she does, but today we're going to focus on this because this is one of my big time things that everybody keeps asking me about. So, Christina, explain maybe number one, what is PEMF?
Sure. I'll start off with a pretty quick visual. The one line is it works on cellular rejuvenation, cellular exercise. The best scenario to give you a visual is to look at a raisin versus a grape. A raisin is obviously it's a mass of cells that are not healthy. And a grape is a healthy, round, circular, it's plump, it's pliable, you can press on it and everything. With a raisin, there's no response at all. It's shriveled, it's dried up, etc. Our bodies have a naturally neutral or negative charge when we're healthy. When there is a disruption to that, the cells get a positive charge. The PEMF attracts to that. The PEMF is a negative charge that attracts to a positive. So you have that magnetic pull to a cell. And that magnetic pull stimulates electrical energy within the cell, chemical and electrical energy within the cell. You can kind of go back to 7th grade science of like protons, neutrons, electrons. That's how everything attracts.
Yes.
Everything on the planet has an electromagnetic field. Everything. So when we're not in good health or a horse is not in good health, on a cellular level, PEMF's job is to stimulate the body's own natural healing ability. That's what it does. So it's not, a cure-all. If the body, there's things that it's not going to benefit, because if things are too far gone, you can't turn a raisin back into a grape. It's just too far gone. So the earlier you start PEMF with an injury or an illness, depending on whether that's part of the protocol and it's safe to do so, the better the cellular response is.
Right.
It works phenomenally on nerve regeneration and neuromuscular response. It works very well with healing soft tissue injuries. Like, I give a good example. My horse, she degloved her legs 3 times.
Only your horse. Yes, only your horse. Mm-hmm.
And so these wounds would have taken several months to heal, and PEMF accelerated that healing process by boosting the body's own natural immune response. So that's what it does. I mean, it's, I think there's a lot of talk on like, oh, it breaks up fascia and it does this and it does that. It works on a cellular level and it restores the healing ability. So hopefully that kind of answers that part of the question.
No, that's perfect. It's a good, well, yes, we can always go off on our things, but that gives it such a good visual. I love the raisin grape, like going into all of that, because that's a great basis, because a lot of people do get confused. Is it like doing the muscular type thing? Is it, what does it involve? So I think that's awesome. And then you kind of talked about, the nerve regeneration and helping with healing and those sort of things. What other things are beneficial for PEMF?
So it works well with muscle recovery. It was designed originally in the early 70s it was brought into a healthcare environment because it had been proven to increase by over 50%, accelerate the healing of non-union fractures.
Wow.
So it was originally brought into the healthcare environment for the healing of broken bones, essentially, because it would cut that time frame by over 50%.
Wow.
So soft tissue, everything kind of depends on how vascular the tissue is, because it's got to have a good blood supply so that the lymph and, blood cells and nutrients can get there. So things like cartilage that don't have a good blood supply, PEMF works really well for, because it tries to stimulate those cells to heal on their own.
Okay.
But cartilage has the least blood supply of all of our soft tissue. It's phenomenal with tears, like suspensory tendon tears, things like that. It does a great job with that. With horses, and I can't tell you why it does this, but it draws out abscesses pretty rapidly.
Oh,
It's probably one of my favorite applications
ooh,
because
that's fantastic.
it really can accelerate drawing out abscesses.
Okay.
I would say personally, mid 80% of horses that I've done with abscesses, the abscesses have blown within 24 hours. There's definitely, it doesn't work in every case. And
Right,
I have to
right.
really point that out because
Yes.
nothing works in every scenario.
Right.
Every body is different. Every equine body is different. Every human body is different. And, we don't always know what the underlying health status is. We can go by what we see, what the blood work tells us, things like that. But
Right.
there's a lot that's subclinical that happens within the body that, can implement or impact rather the healing process.
Absolutely.
So it's not a cure-all.
Right.
But in most cases, it does no harm.
Yeah.
When a cell gets to a point where it's recharged, and people have probably seen this if they've watched, the muscle fascillations across the back when they put the coils on the back or something like that, the muscles kind of fascinate.
Yep.
And they look like they're twitching or being electrically stimulated. That's literally a positive to negative attraction of the magnetic field. The cells are being attracted to the coils. And that's what's causing that little fascillation. And as you progress, you'll notice those fascillations start to slow down, they start to stop, and then the practitioner may turn it up, turn the intensity and the frequency up a little bit. They may make some adjustments to it. But the reason it's slowing down is because the cells are getting a negative charge.
Okay.
So they're rebalancing.
Yeah.
That's why it's slowing down. It doesn't always mean, oh, well, I'm not seeing it anymore, so let me turn it back up. We do that in some instances, but not in others. And that kind of goes back to the training.
Yes.
But in general, there's a lot of talk that it does, myofascial release. I'm a licensed massage therapist for people too.
Yes.
Taken a lot of myofascial courses, and I'm a neuromuscular therapist. Fascial release is a very manual thing.
Yeah.
And because of the way fascia works. So I know a lot of people will disagree with me on this, but I am not a believer that it releases fascia.
Okay.
I do think that it profuses the area with blood flow, and it makes it easier for fascia to stretch. And to restore some elasticity. But if there's adhesions or restrictions in fascia, PEMF is not really going to break that up. Right. It can soften it. It can, help with the cells, but it's not going to break up fascia.
So it would be complementary to, doing it, to a massage or whatever, anything like that. Correct. Oh, that's fantastic.
Yeah. So I use it personally in conjunction with massage. It helps the horses recover from the massage, because anytime we do massage, or even frankly any kind of physical exercise, we create micro tears in the tissue. That's how we build muscle. Right. And so to help that muscle, those cells heal, you can use some PEMF to accelerate that. It helps prevent delayed onset muscle soreness. Which people feel and recognize. You go start a workout program, and 2 days later you're like, oh, I can't move my arms because I lifted weights or whatever it is. Horses actually get that too. So when they go and run a really long course, or whatever their case is, they're working hard. Using the PEMF can help kind of keep the body healthy and prevent some of that downtime for recovery.
And is that something that you recommend? Like, even I know a lot of people who are like at a barrel race and they race, and then would you recommend that then they do it after they're done racing, or like in between their days or how do you recommend it?
The nice thing about PEMF is the more you do, the more the benefit.
Wonderful.
And I have strong opinions on, people that do 10 and 15 minute sessions, and on equipment that has settings for 10 and 15 minutes. If you really look through the research, and I dove through PubMed, the Journal of Equine Veterinary Science. I mean, I dove into this when I first got into PEMF about 5 or 6 years ago. You really, you have to do at least 30 minutes for a lasting cellular change.
Okay.
It's not that the lower time are not going to be of benefit, but to get the cells to hold the charge, just like if you charge your phone, you kind of got to let it get to a full charge.
Okay,
You
that
can't
makes
really
sense.
get to a full charge in a very short period of time. When
Okay.
PEMF, the first kind of technology that came out for PEMF, they were having people, I want to go, the dog.
The dogs are ready.
They were having people do this for 6 hours a day, every day for their fractures. So it became known as like this very impractical therapy.
Right.
So very beneficial, but not practical. Who has 6 hours a day to lay on a mat, right? No. I mean, we just don't have that kind of time. So as technology advanced and they learned how to package it different, to generate it different, that's when we started to get to where we could have adjustable frequencies and adjustable intensities so that we could do more in less time. Right. But it still takes some time. So under 30 minutes really doesn't do a whole lot.
Okay. And that being said too, you mentioned like depending on the different brands. Are there a few different brands that I hear different things all the time, like MagnaWave and those sort of things. So what are some of the top ones?
So the top 3 that are used in equine seem to be MagnaWave. That's the buzzword. I mean, even when you talk about PEMF, MagnaWave's done a phenomenal job of branding PEMF as their thing.
Yes.
So they've done a great job with that. You need to go. I'm going to put this dog out because he's literally going to give me toys for.
No problem.
Come on, out you go. Yes. Come on, quickly, you too. So sorry. I wanted to focus and he's sticking toys in my lap. That's what you do working from home today.
That's right.
So MagnaWave is a brand of PEMF. MagnaWave, and they have a particular type of wavelength, which is one thing that differentiates one unit from the next.
Okay.
So I'll talk about the 3 brands and then I'll talk about which one does what.
Yeah.
And then you have pulse centers, which is usually a yellow or a blue box is what most people are familiar with seeing.
Yep.
They have units that are in, professional grade that go into hospitals and doctors' offices and cost, $50,000. And so they've got some pretty intense equipment.
Right.
And then you have the Beamer blankets, which everybody really seems to love. So I'll kind of share with you what each one does. They all do the same thing.
Okay.
They do it differently because of their wavelengths. Pulse centers and Beamer have a square wave. So the peak of the wave is, it holds that cellular contraction for a longer period of time.
Okay.
And MagnaWave has like a peak and valley. If you think of like the pulse of a heartbeat,
right?
The cellular contraction is at the peak of the heartbeat. So that's where. So with MagnaWave, it's actually a very short cellular contraction connection to the magnet.
Okay.
It's not really a magnet, but that magnetic response. It's a very short, quick connection to that magnetic response, where Beamer and pulse centers, the longer the cellular contraction, the longer you're stimulating.
Okay.
Like that's the longer the magnets are together, positive and negative are holding together, versus that quick touch, you've got kind of a longer hold. All 3 are beneficial. I mean, I'm a firm believer that PEMF just is a great tool to have because of the way it promotes healing. Yeah. But for example, if you took the Beamer blanket, it is such a low intensity and such a low frequency.
Yep.
It's phenomenal for barn owners to have, trainers to have in their program, because it's kind of, and I hope this doesn't insult people, but it's kind of dummy proof. I mean, you can throw the blanket on, set your settings, and then walk away, and the horse gets to pulse while you walk away. That being said, what it takes a Beamer to do in 2 weeks, a pulse centers or a magnawave unit. A pulse centers unit could probably do it in an hour,
Okay.
and a magnawave maybe 3 hours. And the
Okay.
reason I say 3 hours is because of the peak and valley
Right. Right.
peak and valley thing. So it's a very low intensity unit, but it can be used every single day. And it's, you know, it's reasonably priced. I think their equine unit goes for about $4,900, which that's not reasonable in anybody's normal pocketbook. But when you think about what you pay for vet bills and everything
Exactly.
else, you know,
Exactly. Another way
it's
to
not
help
that
out your
bad.
horse.
So Beamer is, you know, I like it for owners to have in their barns, for the daily kind of use. It's a good, throw it on. They come with cuffs for the legs, things like that. So it's a good product. Magnawave I'm a little bit more opinionated about. And you know, I get a lot of flack for it. So hopefully that won't happen in here. I actually like their equipment. They've recently changed their coils. They used to be hard plastic.
Okay.
And now they're flexible. So that was a good change. The hard coils just didn't drape on the body very well, versus the softer, flexible coils that they have now.
That makes sense.
But they still just have, they have, just like the Beamer, it's got set times. And I don't recall exactly what those times are, but I know it maxes out at 15 minutes. I want to say it's like 10, 12, and 15-minute durations that you can use. And then you have to reset it. You have to kind of restart your machine all the time. And so I think the Magnawave price-wise runs around 8,000 to 10,000. If I remember right. That may have changed. So don't, you know, that's opinion, not fact, but I think it's right around there. And then Pulse Centers has the square wave. It's actually rectangular, but it has that square wave. It has quite a bit of adjustability. One of the things that I like and why I chose that particular unit was because there wasn't a timer set on it. I can, depending on the unit that you get, you can independently adjust frequency and intensity. And most equine practitioners don't have the unit that you can independently adjust intensity and frequency. Those are pretty pricey. I mean, you'd be looking in somewhere in the 30,000 north range for those. And those are primarily, I think, used in medical offices where, you know, they're working on somebody with Alzheimer's or Parkinson's or MS or, you know, a lot of neurological type of conditions or some severe orthopedic or musculoskeletal type of conditions is where I tend to find PMF with the adjustability in physicians' offices. But out in the field, it's not really practical. The machine those big machines are really heavy and they're not very portable. So again, we go down to practicality. So with practicality, the 2 units most people see in the field are the EQX and the EQXX. And while they don't have the independent adjustability, they are still adjustable with intensity and frequency. So a little different than the Beamer and the Magnawave in terms of just the equipment and how you use it, like the features. I think the training across the board is lacking, if I'm being brutally honest.
This was another thing I wanted to get into, is that I have a lot of people that ask about it, and my biggest recommendation to them is to find a person who you can trust and is, you know, good at their field. But how do you, like, what are the things you look for, those sort of things?
So I think that goes across the board with equine bodywork. And
I agree.
Not just fits into the PMF box, but because you can have independent PEMF practitioners, then the training does come down to, this is what I think it's missing. That's probably easier for me to tell you that. I think there's a very strong disconnect between people's understanding of equine pathology. So they don't know when they should say no. And that's a really big deal, especially with PMF, because things like cellulitis, you do not want to be pulsing a horse with cellulitis until they are at least a good 7 to 10 days into their antibiotics. And if it's a severe case, you wouldn't even do it then. So you have to really know your pathology, different kinds of diseases and things. You have to know anatomy,
Yes.
you need to know, like, what are you targeting? Because I see a lot, and practitioners putting the coils over the horse's back, and they're kind of over the flank and over that lumbar
Yes.
thoracic area,
Yes.
which is a common sore spot for horses.
Yep.
The problem is that they get to where the horse's muscles are kind of jumping like this, and they want to
Yes.
see that.
Yes.
And the horse's head is down and it's practically drooling. And they're like, look how relaxed it is. That's an adrenal overload. That's an overproduction of cortisol in most cases, where, and if anybody has ever had an adrenaline rush and then come down from that adrenaline rush, you get body ache.
Yep.
It stimulates that. So I personally get really, I can't put my nose in other people's business,
Right.
but
Right.
when I see that or hear of it, my instinct is to correct that, because
Right.
that is not an appropriate response from the horse. We don't want them so disengaged that they're kind of numb to it.
Right.
And then they'll usually I hear practitioners tell people to have their horses on stall rest for a day or two following an intense PMF session. It should energize the horse, not make the horse feel.
Great point. Great point.
Feel lethargic.
Okay.
So if the horse is lethargic after a PMF session, that session was too intense.
Okay. So pretty much, if you're seeing a horse getting this done, they should be doing, are you looking for them to be like licking and chewing and like that sort of thing, like you see with body work, or what are some things that show
licking,
it's in
chewing,
a good
yawning,
state?
Exactly. All of kind of those typical releases of licking, chewing, yawning, even kind of getting the eyes kind of relaxed. I like to see them start to kind of shift their weight. They're having like natural postural sway, and they're ready. They're just getting into a relaxed state. I don't want to see their heads hung really low where the cross ties or whatever, the handler is kind of trying to hold the horse's head up. I still want them to be involved in the session.
Yes.
And when they check out, you're not really, that's a big signal from the horse that they've had enough.
Yes.
And that they're trying to really tell you that they've reached that point of what their body can process for the day.
Right.
And it's not a mental process, it's what the physical body can process. And when you do PMF or Bodywork or FES or any of those things, the body does take some time to integrate those changes.
Right.
That being said, how they integrate those changes is the important part. So if you have adrenal overload because you overstimulated the kidneys, and the adrenal glands pulsing over that flank, and the horse is lethargic with its head down, you've done too much, and that horse will probably be a little bit sore for a couple of days. And that's obviously not a positive response that the owner wants to feel when they go get on their horse or they see the horse just not acting themselves. But I think that, owners don't know what to expect. It's not something that's tangible. You can't see that. You can do it in a petri dish under a microscope. We can show you that a cell will respond, but you can't do that out in the field. So it's not tangible, and owners have to trust that their practitioner is trained and knows what they're doing.
Yes.
So in that question, I think the training really lacks across the board. I've written an awful lot of protocols for PMF. And worked with vets on developing those protocols. And they're shared with MagnaWave pulse centers. They don't use them in their training. And that's okay. They're working on developing their own. And it's hard for me to say this, but like, I've studied the bejesus.
Yes, yes, you have. Yes, it's why I've come to you.
And I really I think I know what I'm talking about. There's always things that are going to come up. Nobody knows everything. And, depending if somebody comes to me with a horse with a particular type of condition, if I'm not familiar with that condition, I have equine pathology textbooks from veterinary universities that I reference. And if it doesn't give me much information, and I shouldn't say if it doesn't, because if it's something I'm not familiar with, I'm always discussing it with the vet before I start a session. Because I'm not gonna go in and do a session on something that I don't completely understand, and assume that because PMF works on cellular health, that it's gonna fix it.
Exactly.
There are contraindications. I've had horses that I've worked on that had underlying Cushing's. It was undiagnosed, and doing PMF on them, they would start to sweat and breathe heavy. If I didn't know that those were signs of their body system being very taxed,
Yep.
I would keep going and be like, oh, they're just sweating out the toxins and they're just sweating out this, which I hear all the time.
Yes.
Not necessarily true. And err on the side of caution and just stop. Until the vet has examined it, because you don't want a tying up episode. You don't want things like that to happen. And PMF, it's a strong, you can really crank these machines up to pretty high intensities with certain brands. And MagnaWave and Pulse centers, for example, like you can get to some pretty high intensities with them. Just because you're not seeing muscles facilitate doesn't mean that the pulse is not going through.
Yes, absolutely.
And so you might not always see it. It doesn't mean nothing's happening.
Right. Absolutely.
And so I think training really needs to focus on like what frequency and intensity do you use depending on the type of tissue you're targeting. Those cells are different. A heart cell is going to be different than a muscle cell, and a cell in a tendon is going to have a different it's going to look different than a muscle cell, and tendons are extensions of muscles. So it's but the cells change, the structure changes. And so they get a thicker cellular wall and so on and so on. And we can get into all the science and it'll bore the heck out of people. But so you need different intensities and different frequencies depending on the type of thing you're trying to target or work with. If you're doing overall body to just, overall recovery for cellular health, like after a barrel race or, a cross-country event or something like that, then you would do the whole body and you would keep it at a fairly low intensity and just let the body do its job.
Good to know.
Yeah.
And then the last thing would just be, we kind of have covered all sorts of good stuff. Complementary. Obviously, I do massage, FES. You've got a few different body works that you've been doing. You have PEMF, you've got the massage, you've got a bunch of different things you're getting into. How does it work complementary wise? Like if I have a horse that I'm like, yes, I want to get the PEMF done. I want massage. I want, we have to get deeper. We need FES. When do you think is PEMF? Is that something you do prior to massage or FES? What is your suggestion there?
So I do a lot of, I fine-tuned my feel personally to where I can do PMF while I'm doing massage. I can do it simultaneously because I know what I'm feeling. There are cases where I'm like, oh, this horse can't handle the stimulation of hands-on work with massage and PMF at the same time. Like it's too much for the body to process, for the mind to process. But I can do most of those simultaneously. And I actually really like doing that. I think that it helps the horse recover. It helps with what we're addressing on the massage itself. So obviously you're finding restrictions, knots, whatever it is that we're finding. Maybe it's just tense tissue or tight or something's restricted. The PMF going, so let's say, for example, I'm working on the horse's neck. Sorry, I'm kind of visualizing this right now. And I'm working on the horse's neck. I might have the coils on the horse's hips or back initially. Sorry, I have an itch on my chin. So I might put the coils on the back, and then as I move down the horse, I'll move those up the horse.
Right.
And so it'll work on the horse on the areas that I've already massaged. And there is a pretty big difference, which I want to point out is sometimes you'll put the coils on and not see any fascillations through the back until you've gone through and done some myofascial release manually. And then all of a sudden the muscles will start to really respond. But the fascia, it's so restricted, literally the muscles are not going to pulse through it. It holds them down.
The web is too tight.
So sometimes the horse's magnetic field's higher than another horse's. So you do have to turn it up a little bit. But the training should teach somebody how to look for the signs of like how to adjust their intensity and frequency on if you're just doing the whole horse.
Right.
So from a complementary perspective, there isn't a single modality I don't really like.
Okay.
And with one exception. And That's, I'll point that one out. I'm not a fan of the kinesio taping. I think it's extremely expensive.
Okay.
You didn't ask my opinion on this, but I think it's really expensive for very little benefit.
Okay.
You know, while it can potentially be helpful to the horse, the cost and how long that tape, it just doesn't make a whole lot of sense for such a short duration. That's in my opinion.
Yeah.
Not that it doesn't work, it just doesn't do anything long enough to justify what it, the cost and time it takes to do it.
Right.
FES, which you do, I actually like FES quite a bit. And how I think that Bodywork, FES, and PMF would really complement one another is, so I see horses all the time that, and I'm sure, Brooke, you see this too, they're atrophied somewhere. They just don't, maybe they haven't been ridden correctly for a really long time, or they've had an injury and compensatory patterns, whatever it is. But the number one thing you hear are, how do I develop my horse's top line, and how do I develop its glutes?
Yeah.
People think that they can feed that with good nutrition. Well, that's the start. You have to have good nutrition to build good muscle.
Yep.
Then they think that they can massage it or pulse it or anything that's going to help it. When it boils down to, those muscles have to get activated.
Yes.
And you know, if you have a horse that, you know, God, I see it all the time. These horses they're weak, either bilaterally or one-sided. They're really locked up through their lumbar. They don't have good flexion or extension through their pelvis, and they can't develop a top line, or the withers are sunken down between the shoulders. I think that when you have a horse that you're trying to bring back into work, or that's rehabbing from an injury, things like that, my favorite, and I know you have a ton of applications for FES, but my favorite application is in that rehab process, or when people are bringing a horse back into work that has not been using those muscles correctly. You can very gently stimulate those muscles to start activating before you start putting them under saddle, or in conjunction with going under saddle. And that stimulation, to me, it works a little bit like dry needling. You're kind of getting in there and you're stimulating things and then letting it go, and stimulating and letting it go. And so I think it, whoops, sorry. That's what happens when you try to touch things. So I think that I think it's hugely complementary to Bodywork that FES is. It can really, there isn't a horse out there that's so perfectly fit in our neck of the woods that wouldn't benefit from these modalities. I mean, it just, you know, there's no rider that wouldn't benefit from it too.
Right. Yes, I absolutely. That's so true.
Because we all have something that's off balance with us. So if order of go, if like somebody was going to choose different modalities, when I went to school for people, and it's at a chiropractic college as well, and they focused all the time that Bodywork before chiropractic in the majority of cases. So if I had a horse that had something going on and I was pulling all the tricks out of my bag, right, I would always start with that hands-on Bodywork. And then I would, depending on if I was looking at weakness or an internal health issue, something systemic or an injury or a wound, I would either go straight to the FES or I would go straight to PMF. I don't have FES. So that's not one of the tools in my toolbox, unfortunately. But if there was, so I would, if somebody wanted to do all three, I would do FES before I did PMF. PMF would be my last thing on that horse. I would do the FES at first.
Okay.
And so, well, after the Bodywork. So I would do Bodywork, FES, and then PMF. It's kind of where my mind goes. I think there's instances where you would do the FES prior to doing Bodywork. I think that I can think of a lot of scenarios where that would be the case. I can't think of a whole lot of scenarios where I would put PMF prior to Bodywork hands-on.
Okay, well, that's great to know.
Yeah, I would, you know, obviously we're talking about incorporating that with a Bodywork session versus a rehab type of situation where, you know, somebody's got a suspensory tear or an open wound, where you would definitely
Right.
I would immediately start PEMF and do body work on the rest of the body while the leg is pulsing or something.
Right.
You know?
Right. Right. Yes.
So things like that. But you know, all of these modalities are meant to complement one another for the
Yeah.
whole health.
Absolutely.
And there isn't a right or wrong, I don't think, with what people choose. I
Right.
think the right or wrong comes down to choosing somebody who knows what they're doing.
Absolutely. I
I
totally
don't think
agree.
it boils down to the equipment or the
Yes.
modalities at all. It's
Yep.
who is doing it.
Absolutely. Absolutely.
And so I'm a big advocate of education.
Yes.
Yeah, I do a lot of owners workshops because I want people to know how to assess their horse. I want people to know how to palpate their horse and
Yep.
understand what they're feeling so they
Yep.
know who to call.
That's
So they
fabulous.
know, like,
Yep.
oh, do I call a massage therapist? Do I need the vet? Do I need chiropractic? Or is this something my farrier can take care of?
Absolutely.
You know, and so like we started talking about choosing the right practitioner,
Yep.
people boil down to like, well, what are your credentials?
Yes.
Here's the tough talk. Credentials in this field mean about jack.
Right. Yes.
They are useless,
Right.
which is really unfortunate. I know there's a lot of work going into changing that.
Yes.
There's organizations that are working really hard to develop at least a standardized test that people have to pass to do this,
Absolutely.
or standard curriculum that all the schools out there teach. I've tried several schools because I wanted to know. I can't like have an opinion
Yes.
about something if I haven't experienced it.
Yes.
So I've tried several schools.
Yep.
I am blown away that we're allowed to go do this with that little kind of education.
I am in your boat. Yes.
And so it has really inspired me to put together programs that are going to help owners be able to differentiate what's a good
Absolutely.
practitioner, what's a bad practitioner. There's what they call imposter syndrome. And I think that there's massive amounts of imposter syndrome in our industry.
Yes.
Everybody knows just enough to sound smart, but if you
Yes.
really pick their brain, they really couldn't tell you a whole lot.
Correct. Correct.
But bodywork, to me, it boils down to intuition. I think it's 80% intuition and like 20% technique and skills.
Right.
If you don't have, well, let me rephrase that. It's probably about 75% intuition and maybe about 15% intent. And the rest is
Yes.
your skills.
Yes. Yes. There you go.
I think. And so when it comes to PEMF, and I know this is going to be controversial, but the training in general is fairly subpar.
Mm-hmm.
I know that both MagnaWave and PEMF Pulse Centers is working on improving that training. But I think people need to understand how long they've been doing this.
Yep.
Ask those questions. You know, people are so afraid to question, except to ask like, well, where did you go to school? Well,
Right.
I could tell them I went to Timbuktu. They don't know.
Right.
But they want to hear you say the name of a school.
Okay.
So credentials don't mean a whole lot to me when it comes to body workers.
Yep.
I do like if they've been to, like if somebody went to equinology, hands down, that's somebody I would not mind working on my own horses, you know.
Okay.
But I'm going to say this, and it might sound a little woo-woo, little hokey or whatever, but we sense an electromagnetic field from people.
Right.
We sense whether somebody has good intentions or not good intentions. It's the gift of fear that God gave to us. It's our fight, flight, or freeze response. We have to trust that. If somebody walks into your barn and they're the friendliest person in the world, but they're very all over the place, and you know, you can judge if somebody's comfortable working around your horse or not.
Right.
You can judge if we have that intuition, we can feel that energy.
Right.
And so I think that's the first thing people need to understand, and is observe how somebody moves around your horse. If they don't move around your horse well, they might not be very comfortable with their job, and it doesn't mean they're bad at it. Maybe they're new or something like that. But you do want to make sure that they've at least gone through some kind of training.
Right.
Ideally, they've gone through some extensive training and they focus on continuing education. There's no way, and this is a pet peeve of mine. I mentor a lot of body workers. I mentor them on their business and education and things like that. They come out of their first class. They just got certified.
Yes.
And they're super jazzed, super excited. And 2 weeks later, they go take another class.
Yes.
And maybe they've gone to take the Masterson method, or they went to take a cranial sacral course, or they took a 2-day myofascial release course.
Yep.
It takes time to develop feel and develop skills. And when you start finding that practitioner you have the two extremes. You have the person who took the one class and it was 4 days to 2 weeks long, and that's it. They're great. They're the rock stars out there and they're going to go conquer it. And I hope they do.
Yeah.
But they still don't know that they don't know.
Yes. Yep.
They don't know. And then you have the other people that go and take the 2-week class or the 4-day class or whatever it is. And then they start compiling all these other things on top of it.
Right.
And they've not mastered anything.
Yep.
So they have all these great credentials, but they've not mastered any of it. And they still don't understand feel. It takes time. I mean, the average human massage class, if you were to go get licensed for human massage, there isn't a class out there that's under 9 months.
Right. Right.
And when you can go up and get, I have an associate's degree in therapeutic massage. And so you can go up to 2 years, and then you still have to have X number of continuing education credits every 2 years.
Right.
And so in order to keep your license, you have to keep learning. And you may not incorporate. I've taken so many classes and there's a whole bunch that I don't do.
Yes.
They don't fit what I want to be doing and what I'm trying to achieve with my clients. It's good to know, but realistically, I'm not going to be working on pregnant women.
Yes.
So,
there you go.
I've taken a pregnancy massage course, but I'm not really going to use or apply that. So taking all these courses, you have to know how to apply it. And I think a lot of practitioners are just so hell-bent to get certified in all these different buzzword modalities. A year ago, it was myofascial release. Who does myofascial release? Who does that?
Yes.
Oh, do you do myofascial release? They don't even know what myofascial release is. It just became a buzzword. And same thing with cranial sacral therapy, which is I'm busting my butt on cranial sacral right now because I freaking love it.
Yes.
But it's going to become the next buzzword, the next fix-all. And it's one piece of a big puzzle.
Exactly.
One piece, one modality that has benefits, just like the FES, PEMF, and I do cryotherapy on horses now too. And it's like,
right. Yes. There's always more and more, but no, I think it's great points that you bring up, that people, to educate people and to, help get the right people out there and hook them up with the right practitioners and those sort of things, which is, the ideal. We just want these horses in their best.
Absolutely. And the people too.
Yes.
PMF can be used on people. FES is used on people.
Yeah.
I think people don't understand that horses are so similar to humans.
Absolutely.
We know, but we don't know. And the difference is our electromagnetic field, our cellular structure is actually quite similar.
That's so interesting.
Yeah, but they are way more sensitive than we are.
Right.
Way more. And so like human PMF equipment, my equipment has 9 layers of copper that are magnetized, that are given a negative charge. The equine only have 4 because they can't handle the level of electromagnetic field that a person can. But it's also why we're really dead to things like weather changes and, sensing something from, 50 yards, 100 yards away, when they can hear or sense something.
Yes.
And they feel those vibrations long before we do.
Yes. So fascinating.
Yeah. And so that comes down to that electromagnetic field as well.
Right.
Yeah.
That's awesome. Well, Christina, you are just a wealth of knowledge.
I've had so much fun, Brooke. Thank you.
Thank you so much. And again, this is Christina Kupper, and she's got Equine Kneads, so you should check that out. And then I'll link to all of this as well. But
Awesome.
thank you,
Thanks for
Christina.
having me, Brooke.
Have a great day.
You too.